Director John Singleton and actor Luke Perry among those who recently died after suffering major strokes. And it's brought on more awareness for everybody to understand that a stroke can happen to anybody at any age at any time. Bridget joins us now with the neurologist who shares more. Bridge?
Hey, thanks, Dash. Joining me tonight is Dr. David Wynn, a neurologist and vascular stroke specialist at the Palomomi Medical Center. Doctor, we heard Dash say it a little bit, but a stroke can happen to anyone at any age.
That's correct. So what a stroke is it's a disease that causes decreased blood flow to the brain, decreased circulation. And there are two types of strokes out there. The first one is a blockage of the blood flow to the brain, usually caused by a blood clot. The second type of stroke is caused by a rupture or bleeding in the brain, causing less blood to get to the brain.
We did say that it can happen to anyone at any age, but is there a particular group that is more susceptible to this debilitating attack?
So usually the older you are, if you have a strong family history of it, if you have uncontrolled diabetes, high cholesterol, high blood pressure, or if you're a smoker, those are risk factors for having a stroke.
And if you, God forbid, get a stroke, it's something that happens quite suddenly.
That's correct. So stroke is a sudden disease. This blockage happens or this bleeds happens, and quickly the brain cells can die. And so when that happens, we always tell people to look for symptoms. We always tell people to act fast. And what does fast stand for? F, meaning if there's a facial droop. A, meaning if there's any asymmetry in the arms, if there's one side of the arms that's weaker than the other. S, meaning if there's any slurred speech or trouble finding words. And if you have any of these symptoms, then we tell people it's time to call 911.
Act fast, face, arms, speech, time.
That's right.
Are there ways that people do to minimize their risk for a stroke?
So we always advocate that people should watch what they're eating, watch how much sugar, how much salt they're eating, try to exercise regularly. We advise people to try to exercise at least 30 minutes a day, 5 days a week. Of course, if you do more, the healthier you are. We tell people to avoid smoking and also to just watch what their lifestyle.
So basically, get rid of all the vices, right? Sugar, salt, smoking. Got to work out at least 30 minutes a day. So the healthier you are, the greater you minimize this.
That's correct.
And one more time for us, why is acting fast to get medical treatment for a stroke extremely important?
So it's important to recognize stroke symptoms because there are potential life-saving therapies that we offer in the hospitals. So when you do recognize the stroke symptoms, we tell people to call 911 immediately. And what a lot of people don't know about this is when you call 911, the paramedics come, and if you're having stroke symptoms, they'll actually notify the hospital ahead of time, and so that everyone can get prepared to receive you when you get to the hospital. And when that happens, when we bring you in, if this is indeed a stroke, there are clot-busting medications that we can give to people, and that could potentially change their lives and save their lives, which we have done many times.
Well, May is National Stroke Awareness Month. Dr. David Wynn, thank you so much for your expertise.
Thank you for having me.
Dash, over to you.